So, welcome to Vedicus, everyone. We are on our 7th episode of Healthy Talks with Ayurveda. My name is Ofra. I'm from Israel. I practice Ayurveda, and I would like to represent to you Vedicus. Vedicus started this foundation in 2015. When we started to have those webinars of Vedicus, we already had a history of practicing Ayurveda with many others, sharing the knowledge of the Vedas when it comes to blog and to medical camp, who are mainly free, and taking care of healthcare in many aspects, also yoga and dental checkups and many other initiatives who are not always seen to the public, but, going to the government, asking for that, showing this, and continue pushing this amazing vast knowledge. We try to host every week a lot of information and bring you some, the tip of the iceberg from some subjects that we think that are very important to promote the Ayurveda and the health at house. We will touch other systems as well, like Unani and Siddha, and many traditional system of health. And of course, cooking was the first line and the basic to promote health. And of course, Dinacharya and Ritucharya, that are how to maintain healthy life with a routine. Today, we have the second time a very honored guest, Dr. Swati Chobhe from Pune. Hello. Dr. Swati is a professor in her college. The college is actually in Nigdi, Pune. It's a PDEA, Ayurveda College and Research Center in Pune, Maharashtra. And Dr. Swati is the HOD of Kriya, Sharir. Dr. Swati have also written many books, and two of them I got to know from Chaukamba publication about how, it's actually in English, it's an Ayurvedic physiology. Her main interest nowadays, and I'm saying nowadays because she had many topics at the past, nowadays it's the blood. Our previous lecture was about anemia and how to handle that. And today we have a very special topic about how to understand blood pressure, because blood pressure is not always from the same reason to each and every one. And this is what we're going to see in this meeting. Since Dr. Swati is also a trainer of teachers, so this is going to be the same. She's going to train us how to think, and she, of course, will meet her in many more lectures. So she's going to teach us now today only some aspect about blood pressure, because there are many more to come. So each time it's going to be a different segment that we're going to shed the light on. For any questions, please let us know in the chat box or in the WhatsApp group. I will share now my screen for the PPT, and Dr. Swati, please start.
Thank you, Ofra ji, for my kind introduction. This is my second lecture for Vedicus, and I'm very much thankful for Vedicus for giving me an opportunity to share my views about Ayurveda and health. Today, I'm going to talk about blood pressure and how to control high blood pressure with Ayurveda. So let's see what is blood pressure. Blood pressure is the lateral pressure exerted by blood on the walls of the vessels, on the walls of the arteries and veins. Everybody has got blood pressure. Without pressure, blood will not be able to flow in the blood vessels. So, under certain pressure, blood exerts pressure on the walls, which we call as blood pressure. Normal blood pressure in adult person is 110 to 120 by 70 to 80 mm of Hg. Means upper blood pressure is higher, that is called as systolic blood pressure, that should be within the range of 110 to 120 20. While lower pressure, which is diastolic pressure, it should be within the physiological limit 70 to 80 mm of Hg. So what is the purpose? Why we need specific pressure to we need this blood pressure so that blood can smoothly flow in the vessels and blood can flow at the cellular level so that every cell will receive oxygen and glucose and other nutrients for their physiological activities. So, to get nutrition, normal blood pressure is immensely important. But nowadays, as we start aging, or even young generation is facing problem of high blood pressure. High blood pressure is common, while low blood pressure is that way comparatively not common. High blood pressure, there are many causes why we get high blood pressure. Now let's see some physiology about blood pressure. To maintain normal blood pressure, we need healthy cardiovascular system. Like heart and blood vessels should be very much healthy. So our heart should pump 70 to 80, 70 to 75 beats per minute. To maintain this healthy blood pressure, we must have healthy food habits and we must develop healthy lifestyle and happy mind, because Ayurveda says that you having healthy body is not enough, but along with healthy body, your mind must be very fresh and happy. So for health of cardiovascular system, our mind must be very happy. I will give you one example of happy mind or unhappy mind. If we are continuously depressed, then that automatically have effect on our heart and blood pressure, and then we tend to increase our blood pressure. So our happy state of mind is important for normal blood pressure. So now we are going to see what is the healthy food for blood pressure and what is the healthy happy mind and healthy lifestyle for healthy heart and healthy blood vessels. So high blood pressure in medicine is called as hypertension. There are two types of hypertension. One is primary and the other is secondary hypertension. This primary hypertension is most of the time is because of stress, mental stress, and most of the time we have tendency of high blood pressure in families. So if our parents are hypertensive, then the children are also going to get high blood pressure. This type of high blood pressure is called as primary or essential hypertension. Another type of blood pressure is secondary hypertension. It is due to other diseases such as kidney diseases, thyroid dysfunctions, the thickening of blood vessels like atherosclerosis, then pregnancy, menopause, high cholesterol. There are many causes of high blood pressure. So what does Ayurveda say about high blood pressure? That we have to see. According to Ayurveda, blood is flowing in the vessels, means blood is moving, and any movement in the body comes under the domain of Vata dosha. So Vata dosha, according to Ayurveda, controls blood pressure. There are 5 types of Vata dosha, and among 5 types of Vata dosha, Vyanavayu is important to control blood pressure because Vyanavayu controls pumping action of the heart, and Vyanavayu also controls lumen of the blood vessels. So vasoconstriction, narrowing of the blood vessels, and vasodilatation to make the blood vessel lumen broader, that comes under the control of Vyanavayu. So Vyanavayu is the main which has to be under balance, in the balanced state, so that our heart will pump only 70 times per minute per minute, so that every cell will receive oxygen and glucose for their physiological activity. Along with Vyanavayu, Pranavayu is also important because Pranavayu is located near in the brain centers, and that controls that maintains blood pressure. So whenever Pranavayu also get imbalanced, then also we have to face problem of high blood pressure. So Vyanavayu and Pranavayu are the two most important types of Vata dosha which control blood pressure within physiological limit. Then Sadhak Pitta, we should not forget Sadhak Pitta, which get imbalanced due to stress, anger, and when we become very competitive, yes, I want this, I want that, I want everything, then that affects adversely on our heart, and our blood pressure increases. So Sadhak Pitta balance is also important along with Vyanavayu and Pranavayu. So this is about Vata dosha and Pitta dosha. And normal body weight is also important. Whenever there is increase of Kapha dosha and Meda dhatu, then person gains weight, and due to increased body weight, blood vessels receives more blood flow offers more resistance to flow, and so low body weight or body weight according to height and weight is important for normal blood pressure. Then digestion, normal healthy digestion or a healthy digestive system is also important for maintaining normal blood pressure. So according to Ayurveda, normal digestion means balanced state of Agni, digestive fire, and Pachaka Pitta, Samana Vayu, and Apana Vayu. All these constituents must be in the balanced state, so that whatever food is taken, that is ingested and absorbed, and that maintains blood pressure. So according to Ayurveda, these are the factors which control blood pressure. So along with Vata dosha, Pitta dosha, and Kapha dosha, we have to take into consideration some tissues like Rasa and Rakta dhatu. Whenever Rasa and Rakta dhatu get imbalanced, then also that exerts adverse effect on heart and blood vessels. I will give you one example. These tissues, Rasa, Rakta, Mausa, Meda, all 7 tissues are formed or synthesized from the food we eat. If we continuously eat oily food, if we continuously eat meat or cheese or butter or fried food, then this rasa dhatu become more snigdha, more anxious, and it becomes more heavy. It becomes more heavy due to if we eat heavy food, rasa dhatu will become heavier, and this heavier rasa dhatu will not be able to flow at a particular speed in the blood vessels, it will become slower. That will increase pressure on the walls of the vessels, and that person will suffer from high blood pressure. So we have to take care of rasa dhatu and rakta dhatu by by eating healthy food. That we are going to see later, what type of healthy food is needed to maintain blood pressure, normal blood pressure. Regular motion, simple thing, regular motion. You must eliminate your natural urges related to digestion. When you are hungry, you must eat. When you are not hungry, you should not eat. When you must keep your bowels open regularly. You should not constipate yourself. According to Ayurveda, if you constipate yourself, then Vata dosha also get increased, and this increased Vata dosha continuously that will increase your blood pressure. So keep your bowels open, regular motion, have regular motion, then you will not suffer from high blood pressure. So may balance your Agni, balance your motion, then have good sleep, because sound sleep is the one of the pillars of the health according to Ayurveda. So good sound sleep must be followed. So nowadays what we can see, that all younger generation are addicted to smartphones, and late night they watch their smartphones, they are on social media platform, they watches web series late night, and they sleep late night, and they get up late, and that imbalances their circadian cycle, that imbalances their Vata dosha predominantly, and if continuously this happens, then person will suffer from high blood pressure. So we must take care of Vata dosha by eating food at right time, sleeping at right time, going for keeping our bowels open every day. These are the simple remedies with which we can maintain our blood pressure within physiological limits. So what are the culprits? What are the culprits? Wrong food, late night sleep, late night sleeping, late night partying. All these are the main culprits, and stress, work pressure. These are the all main culprits. And what are the effects of these blood pressures? So remember one thing: high blood pressure is a silent killer. Sometimes you won't have any symptom. You won't have any symptom of high blood pressure. Suddenly you will come to know that yes, I'm suffering from high blood pressure. Or sometimes you have headache or fatigue with minimal exertion. Sometimes blood pressure shoots so much that you will faint, because your brain will not get enough blood supply. Then insomnia, lack of sleep. This is also main symptom of high blood pressure, and breathlessness on minimal physical work. These are the symptoms of hypertension which you should not neglect. So what happens when blood pressure increases and you start taking anti-hypertension pills? Whenever blood pressure increases, blood vessels start narrowing, and these capillaries become so narrow that the oxygen and other nutrients cannot be supplied to cell, and so there is cellular ischemia or organic ischemia means organ cannot receive blood to function. This is called as ischemia. So ischemia is the main effect of long-standing hypertension. Sometimes blood pressure increases so much that blood vessels cannot cope up with this increased pressure, and these blood vessels get ruptured. If these blood vessels to the brain get ruptured, then we call it as brain hemorrhage. This brain hemorrhage can affect so badly on human life that because patients due to brain hemorrhage suffers from stroke, which is called as brain stroke, which results in muscle paralysis. And due to muscle paralysis, a person will get disabled to move. Then, due to high blood pressure, person may have long-term side effects like blurred vision. Due to hypertension, retina also cannot receive oxygen, and person can get blindness also due to hypertension, which is called as hypertensive retinopathy. Then, due to atherosclerosis. Do you know what is atherosclerosis? As you age, as you become older, as one become older, then blood vessels become rough from inside. Internal layer of blood vessel become very rough, and when person is eating fatty food, then this fatty food cannot be digested by this Jathara Agni and Pachak Pitta, and due to this low digestion and low metabolism, this fat is converted to cholesterol plaques, and this cholesterol start getting deposited inside the blood vessels, which is called as atherosclerotic plaque, which due to which blood vessels become narrow, and due to narrowing of the blood vessels, blood cannot flow through the blood vessels, and organ or cell cannot receive enough blood. So, not getting enough blood supply to important organs like liver, kidney, and brain, these are the most important adverse effects of hypertension on humans. And due to this, person can get, if atherosclerosis of blood vessels to brains takes place, then person may get stroke, dementia, etc. If person get atherosclerosis of blood vessels of kidneys, then person might suffer from kidney disease or kidney failure. So these are the side effects or adverse effects of blood pressure. So this blood pressure is a silent killer. So how to control this blood pressure? Because it is a silent killer. It leaves very bad impact on vital organs of the body. So when you start having symptoms like headache, fatigue, you must visit your doctor. Then you must have regular blood pressure checkup. Then your doctor will prescribe you some medicines to maintain your blood pressure that you must take regularly. Then you must control your body weight within normal limit, like according to your height and body weight. Your BMI must be between 19 to 25, so that your blood pressure will be within physiological limit. Then you should live your sedentary lifestyle. You should walk, you should run. This running or walking will help to burn extra calories, and your body weight automatically will get reduced. Your blood vessels will open up and blood flow will be smooth and your high blood pressure will come to normal. So regular exercise, regular aerobic exercises are very much important to maintain high blood pressure. Nowadays, younger generation between 30 to 40, they also suffer from high blood pressure due to demanding lifestyle, demanding job profiles like job stress, then wrong lifestyle, alcohol consumption. These are the few important causes in younger generation. So you have to keep yourself away from alcohol, smoking, and stress and demanding lifestyle uh, to maintain your health and blood pressure. So, what should along with exercises, if you want to avoid stress, you must follow yogasana. You must follow yogasana. You must do yogasana regularly, and along with yogasana, you must do Surya Namaskar or solar salute and regular meditation, regular breathing exercises to keep your mental balance and keep your mind happy. So, what these solar salutes or Surya Namaskar will do. Surya Namaskar, regular meditation will change your lookout. You will become calm. Your mind will become calm. Your channels, all channels will get opened. Your blood vessels are also channels. So your channels will get open. You will become calm and quiet. Your digestive system will get balanced and you will become happier, and your happy mind will leave impact on your cells, and your cells or cells will also become very happy. And because cells, according to Ayurveda, also has control cells are also controlled by mind. So happy mind will make your cells happy with the help of yoga, meditation, and exercises. So what type of breathing exercises you should do? You must do anulom vilom pranayam. You must do Bhasrika, you must do Brahmari, that will tranquilize you, that will reduce your stress, and your satisfaction level will increase, and automatically your cardiac heart function also will get balanced. So, along with food, exercises, and yogasana, solar salutes, breathing exercises are most important. Now, what type of food you should have? That is the most important topic. What should I eat to control my blood pressure? You must follow vegetarian diet. For if you want to maintain your heart healthy, then you must follow vegetarian diet. Leave non-veg food. Leave fatty food. You must drink warm water immediately after getting up early in the morning. Then, if then you should have many vegetables, green leafy vegetables in your diet, like spinach, then fenugreek, then you should have milk and milk products, but milk products you should consume in a very limited manner. But warm milk with pinch of dry ginger is okay to maintain your blood pressure. Then you should have green moong soup. Green moong soup is very useful to maintain your blood pressure. You must include healthy fruits in your diet. Pomegranate is very effective to maintain heart and blood vessels because pomegranate, amla is very essential in your diet. Then papaya is also very useful to maintain your heart healthy. Then you should not consume cheese and butter in a larger quantity because cheese and butter they increases your cholesterol level. So you must eat lighter food. You must have your dinner before sunset. It is very essential to have dinner before sunset. So you must follow healthy food and healthy lifestyle to maintain your heart. There are many Ayurvedic medicines, but more than medicines, it is important to control your blood pressure with food and diet. So if you have more stress due to work pressure, you can have Brahmi or go to Kala tablet. Then you can have Saraswata to reduce your stress level. Then you can have if you have more cholesterol level, and due to high cholesterol, if you are having high blood pressure, then I will give you one simple remedy. It is an Ayurvedic remedy that overnight you can soak fenugreek seeds in water, and early in the morning you can have that water, fenugreek seeds water, immediately after getting up. That help to reduce your cholesterol levels. Along with fenugreek seeds, the most important herb is garlic. So garlic is very important. It reduces cholesterol, and this garlic you can have with milk also. That is called as rasona shirapaka. You can boil garlic with milk, and you can have this garlic milk to reduce your cholesterol level and to maintain your blood pressure. So garlic and fenugreek, they help when you have high cholesterol level, and due to if you are suffering from high blood pressure due to high cholesterol level, you can you can include garlic and fenugreek in every food stuff. Then you can have to maintain to keep your bowels open. I just previously told you that you must have uh, regular bowels, and if you have tendency of constipation, every night you can have warm milk with 1 teaspoon of cow ghee, and that will make your intestine and stool soft, and stool will be easily eliminated from the bowels in the morning. So you must uh, keep your bowels open, and for that purpose you have to follow some Ayurvedic remedies for that purpose. Then you can have Trifaya tablet to keep your bowels open. Then you have, if some patients suffer from gases. So if a person is suffering from gases, flatulence, then ask to use asafoetide.
Slides have ended, ma'am, but Dr. Swati is on mute for unknown reason. I will try to do something about it.
So shall I repeat how to
Yes,
control
please.
cholesterol levels?
Please.
Yes, ma'am, you can repeat it.
Okay.
Thank you.
Many times nowadays, high blood pressure is due to high cholesterol level, and this high cholesterol level is very risky for cardiovascular system. So people start taking anti-cholesterol tablets, but that is not enough. Along with anti-cholesterol tablets, blood thinners like aspirin is also prescribed for patients, but that is also not enough. So what food stuff we should incorporate in our food? What condiments? There are two food stuff or 2 herbs which we can use every day. They are fenugreek seeds. Fenugreek seeds have anti-cholesterol effect. Fenugreek seeds reduces your high blood pressure dramatically. How to take these fenugreek seeds? You take 1 tablespoon of fenugreek seeds, soak it in 1 bowl of water and keep it overnight, and early in the morning you can have this fenugreek seed water, strain that water and you can have this fenugreek seed water to reduce your cholesterol level and your high blood pressure. The second one is garlic. Garlic is the boon for high cholesterol patients. While preparing food stuff, we must use garlic to reduce our high blood pressure and to reduce high cholesterol level. Then you can have garlic milk also early in the morning. How to make this garlic milk? You can take 1 cup of milk and you add 2 to 3 garlic cloves and boil that milk, and after boiling for 10 minutes you can have this garlic milk to reduce your cholesterol level. That is called as rasona shirapaka. Rasona means garlic. Garlic milk. It is very important because it reduces cholesterol level. So fenugreek and garlic, these are the two herbs which reduces cholesterol levels. But remember, if someone is suffering from high pitta or some patients have pitta prakruti, they should not use garlic because garlic increases pitta dosha. That also we have to remember. So along with garlic and fenugreek, high cholesterol person should avoid fried food, cheese, meat, etc. and should consume warm and freshly prepared low fat diet. So this is about how to maintain high blood pressure due to high cholesterol level. And if you have high blood pressure due to stress, then you should opt yoga, Surya Namaskar, solar salutes, and meditation, breathing exercises to maintain high blood pressure. To reduce stress, you can have Brahmi tablet or Saraswatarishta. So, healthy food, regular sleep, getting up early in the morning, then exercises, and to minimize the demanding lifestyle. These are the factors which will help us happy and which will make us healthy and which will maintain our blood pressure. So thank you very much. If you have any question, you can ask.
Thank you so much, Dr. Swati.
Thank you, ma'am.
Do you want to
Thank
ask
you.
some? Yes.
May I ask a question?
Yes, please.
Ma'am, how to reduce the Meda Dhatu? And mainly first question is this, how to reduce the Meda Dhatu?
Just now I told you, if you want to maintain balanced state of Meda Dhatu, then you have to eat low calorie food. You have to exercise. You have to do solar salute, Surya Namaskar regularly. And you have to follow regular sleep patterns because not sleeping at regular time, getting awake at night is the main cause of obesity nowadays. So close your internet at 10 p.m. and just go to sleep to maintain your weight.
Ma'am, thank you for very nice lecture. Can you please explain that how the methi, like the mode of action of methi?
Yes, definitely. Methi or fenugreek. it is tikta, it is bitter in taste. It is dry, it has got dry property, it is bitter in taste, it is tikta rasa. So this tikta rasa is anti-kapha and anti-meda, because kapha and meda, they have madhura property. And so, according to Ayurveda, this methi, that according to Samanya Vishesha Siddhanta, that reduces cholesterol, because this cholesterol, fatty foods, they all are madhura, sweet, and this bitter taste is opposite to madhura. So, methi reduces cholesterol.
Ma'am, all you
Yes.
told for reducing Veda Dhatu, all these are included in a patient's lifestyle. Means the Surya Namaskar, walking, jogging, exercise, sleeping on time, and having home cooked food with
Yeah.
the avoiding fried. That all has been done, and even then Veda Dhatu is still there.
You have
Sushma
to,
ma'am, just a minute. Sushma ma'am, this is a professional consultation. So maybe for the broad, vast people that like the common people that are here, maybe we should keep those kind of questions, and you can share the question with Dr. Swati in the chat or send it to me, and we can communicate, because we don't want to confuse everyone, because like there are professional terms and we want to speak to the major population.
Fine,
So,
fine. It's fine. It's fine, ma'am.
thank you, Sushma. Any more questions? So please unmute yourself. I see Ishwarya, would you like to ask a question? Please unmute yourself.
Yes, ma'am.
Please.
Yeah. Ma'am, my question was that if any patient have blood sugar levels high and also BP high, then what we should intake?
for high blood pressure and for diabetics. Actually, diabetes and hypertension, they go hand in hand, because
Yes, ma'am.
if you learn pathophysiology of diabetes, then diabetic patients have tendency to develop high cholesterol levels later on, and due to high cholesterol level, atherosclerosis and narrowing of the lumens of the blood vessel. This is the pathophysiology of high blood pressure in long-standing diabetes. So, in most of the diabetic patients, due to high cholesterol level, patient has
Dr. Swati, your microphone is, we don't have a good connection. Just a minute.
fenugreek seeds water, garlic garlic consumption regularly is important to maintain blood sugar also and cholesterol also.
Okay, ma'am. Thank you so much.
So, Dr. Swati, as Dinacharya, like lifestyle management and seasonal management, are there any recommendation or any introspection about how blood pressure is affected by that?
See, whenever we get up late in the morning, naturally the circadian cycle get disturbed. Circadian cycle get disturbed, that increases Vata dosha, that increases your blood pressure. According to modern medicine also, whenever circadian cycle get deranged, then catecholamines get increases, like adrenaline. And according to Ayurveda, Vata dosha increases if you don't follow Dinacharya. And so, this following Dinacharya is important to maintain normal blood pressure. To maintain, because if you follow Dinacharya, then that will balance not only Vata dosha, but that will maintain Vata, Pitta and Kapha. Because
So
if you get up early,
you're actually telling us to do a regime that will fit our good health.
Health.
What is a good regime according to maintaining good blood pressure?
Get up early. Ayurveda recommends get up early, at least at 6 in the early morning. Then have warm water.
Mm.
Then have herbal tea.
Mm.
Then if you are Pitta, you have Pitta Prakriti, you are Pitta Prakriti, then you should have breakfast. If you are Kapha Prakriti, you don't need to have breakfast. But for Pitta Prakriti, they must have breakfast. Then everyone must follow lunch timing. And the diet should be balanced. Like one shouldn't, according to Ayurveda, one should not eat balls of green salads. Because green salads are uncooked according to Ayurveda. So food should be cooked. And green salad should be very minimum in the diet. It is required, it is essential for fibers. But it should not be like balls of salads for lunch, balls of salads for dinner. That will derange your Agni and Pitta, and that will increase your Vata dosha. So it should be in a lesser quantity, and cooked food should be in a greater quantity.
There is a
How
question.
much raw allowed? How much raw?
How much?
How much green salad is fine?
Very minimum. Very minimum. Very minimum.
100 gram, 200 gram, 500 gram.
Like one cucumber,
Fine.
half of tomatoes. Not like balls. I will have only salad for my lunch. I will have only salad for my dinner. This is not recommended in Ayurveda. Ayurveda recommends cooked food. Because uncooked food will increase your Vata and Pitta. That will imbalance your Vata and Pitta.
So for evening, what would you recommend to have before going to sleep, or when to have? What is the day regime that you would recommend for the evening?
You take regular. Just now I told you you should get up early in the morning. Then you should have your own chores in the morning. You should, if you get up early in the morning, bowels automatically will get open. Then
what about evening time? We come back from work, office, kids come from school.
When you come back from work to home, then you should have dinner actually before sunset. But if it is not possible, then at least not at 12, not at 11, but at least at 9 in the 9 p.m. 9 in the evening. And you should concentrate on your food. You should not sit and watch TV and have food, because Ayurveda says that you should, with full concentration, eat meals. And nowadays, everyone has a cell phone in one hand and eating food with another hand. This is not recommended in Ayurveda, because if we do not concentrate on our meals, then that affects secretion of Pachak Pitta, secretion of digestion, secretion of digestive juices, and that will ultimately affect digestion and absorption of food. So with full concentration on dining table with family members, you should have meals.
There is a question. Thank you, Dr. Swati. There is a question in the chat. What about nephrological disease and high blood pressure? Would you give us an angle on that too?
What is
nephrological kidney disorder?
Kidney disorder, nephrology.
Right.
So let me read that. Can you repeat the question?
What about nephrological disease in high blood pressure? What would you recommend?
In Ayurveda, for nephrology, we must protect our kidneys. And if you consume high protein diet, then that will definitely affect your kidneys. So if you have high blood pressure, then you must protect your kidneys. And there are few herbs which are nephroprotective that you can recommend, like Punarnava. Punarnava is nephroprotective that you can use. But I will suggest that protect your all vital organs by following regular lifestyle, including good food, aerobic exercises, and yoga and meditation. Because medicines are the last in the list of health. And there are many side effects of antihypertensive drugs. They affect very badly the digestive secretions, hydrochloric acid secretions. They affect sperm motility also in a long term view. So if young person is on antihypertension pills, then there are side effects on sperm motility also. Or that person may have erectile dysfunctions also. So you must take care of your heart and blood vessels and blood pressure by following healthy lifestyle. That is the most important, because according to World Health Organization also, this hypertension is included in non-communication diseases like metabolic disease.
Dr. Sushma, do you want to ask any more about that?
No, ma'am, thank you. I was having that question only, that how to reduce Metta Dhatu even after following a good daily routine, getting up at 5 a.m. and doing exercise, yoga, home cooked food, doing everything. If Metta Dhatu is not in control.
I will say just one sentence, that you must see your family history also. If all are overweight in your family, then also it is difficult to reduce weight with all these or by following healthy lifestyle also. So genetic pattern should be taken into consideration for obesity or overweightness.
Yeah, that's true, but that's not the case.
We know that Ayurveda is looking through details.
We have to see the patient.
I will connect between the two of you, and we will try to get a solution and advice from Professor Swati.
There are many causes that you have to rule out. That even you have to check your thyroid functions also for that purpose.
Clinical tests are all fine.
Okay, then this is not the platform, I think, to discuss this.
Maybe.
Thank Dr. Sushma, please share your details. We'll take care of this. You will get your answer. Any more questions?
Thank you very much.
Okay. I would like to ask another question, Dr. Swati. What would be the effect of coriander on high blood pressure? How would you recommend to consume coriander? Like dhania is so important in Ayurveda regime when it comes to that. What is your recommendation?
Dhania is like it will work as like diuretic. Dhania and jeera, that will work as dhania, jeera and gopshur. That will work as diuretic. And that are good for kidney also.
Thank you. Thank you so much for the vast knowledge that you shared. I guess that we will have more talks about this from many angles. And thank you everyone for coming and sharing this time with us. And join the group and ask the question there. Dr. Swati is a member of the chat group. So please join us there, and we'll see you next week with more surprise about stress management, as we want to control many things with stress management as well.
Thank you very much.
Thank
Thank you.
you.
Thank you.
Thank you. Well.